coming from a coaching perspective, like being a motivator and having that academic and field performance training to motivate people, that directly applies in this position a lot because people aren't motivated to come to work every day.
Hello, everyone. Welcome to the Briotix Health Spotlight, where we speak with providers, subject matter experts, and other key players in the field about the various aspects of work and wellness that are affecting you and your company today. We are joined today by an ISMP from Briotix Health, Brian Binkley, an employee who has seen both sides of the health and wellness industry as a coach for strength and conditioning, and now on the industrial side of things as an industrial sports medicine professional. Caring about the work you do every day makes a difference, and understanding the long-term effects care can have on an employee's life gives that work meaning. As a coach and now a provider, Brian understands that difference. Hey, Brian, thank you so much for joining us on the Spotlight today. I'm really excited to talk with you. And before we really dive into the subject of today's conversation, I'd like to just know a little bit more about you. How'd you join Briotix, and what's your background as an industrial sports medicine provider?
So I actually lucked out in joining Briotix. I never even heard of the company before. I was working with military police battalion when I was in Fort Liberty, North Carolina, and I was primarily working with just like the physical conditioning portion of the H2F project for them. And we had to relocate down here to Florida, so I was trying to figure out how to stay within the DoD realm. And Briotix actually popped up, and they were with a company located in Florida. And I just gave it a shot and just kind of learned more about them throughout the interview process and liked what I heard and started researching them a little bit more and liked what I saw and kind of just, slid right in, if you will. And, the idea of the industrial sports medicine professional, while that's a really cool term to hear, really it kind of hits the core central portion of I feel like anybody who's in the health, wellness, and fitness industry, like we're all kind of trying to do the same thing. It's just some are in this position now as the ISMP, we're working directly with employees in the workplace versus the general population at their home or in a gym or even the athletics population in a sports performance environment.
At Briotix Health, one of the primary messages we try to communicate is prevention first. How do you see your role as an ISMP and your background in exercise science as kind of aiding that goal of prevention?
I feel like it's kind of the first step, right? Like, there's when you're approaching health in general, you can be proactive or reactive, right? So obviously on the preventative side, like I don't want you to get hurt. I don't want people to be unhealthy. Like I always joke about this, and I'm like, I'm the guy who's keeping you from going to the doctors, because the idea is like you shouldn't have to unless it's a catastrophic emergency. If we can do, these things
Yeah.
and keep our wellness in control. So with that being said, a lot of my background is in coaching from the sports performance world. So I look at it as kind of a total body thing. Like you got the individual human, right? What's their general health status? What's their, we look at their posture specifically. I do a lot of work with people's just general posture because even outside of the working world, if you have poor posture, like, all of a sudden you're moving differently, you're moving inefficiently, you're breathing inefficiently, like everything makes your physical world harder by doing that. So with that in mind, I kind of attack it from that perspective. Like I don't have the traditional ISMP mindset where I'm going to come in and I'm going to teach a person how they should be doing their job specifically from a biomechanics perspective, but actually look at like, well, what's the potential root cause here of why they're already moving poorly to begin with? And a lot of times it does fall into that posture related inefficiencies. And then if I can correct those, everything else kind of falls in place and takes care of itself.
Yeah. I mean, even when you're just talking about posture there, it reminded me to sit up straight, kind of bring my shoulders up, hit into that right spot. So just having that reminder there is definitely something that's always helpful. Another thing that we talk about is discomfort in the workplace and how it affects so many other things in a person's life. As a leading indicator for injury risk, what are you thinking about when you're talking to an employee about discomfort?
Um, I usually think about like what are they receiving? Like what are they understanding? Because it doesn't matter what I'm telling them unless they're able to absorb that information and figure out a way to connect with it. When I was coaching, we always say like it doesn't matter how much you know, right? It matters how much you care. And nobody cares how much you know until they know how much you care. So, I kind of when I first swooped into this position, I spent a lot of time in my first 90 days just walking around, talking to people, getting to know them, just like chit chatting a lot, building rapport. And I feel like that has been very successful in our approach here because now people do come to me without, it being crazy. They're like, they don't have to wait like 6, 7, 8 weeks before they're like, I can't move. We have a lot of people who will call out to me essentially before it even gets close to being bad. And, while I'm working with them directly on the floor, trying to help them understand that. I just make sure they understand what I'm talking about. And if they don't, that's okay. We just kind of keep bringing it down a level or keep kind of, I don't know, you kind of like repackage it and redeliver it. And hopefully one way or another, they kind of get it.
Well, something I hear when I'm, hearing about success stories at Briotix or writing a new case study that we're putting together is the leading factor and, the most essential element that always brings the whole program together is that ISMP that cares and that ISMP that really, goes that step beyond to make a difference and brings in their background, brings in, the knowledge they have to connect with the people in the workforce. From that strength and conditioning and that biomechanics background that you have, what do you bring with that skill set in to help with someone that's experiencing discomfort? Do you see a direct translation of those skills of strength and conditioning to industrial ergonomics and the workplace that you're in now?
Uh, so yes and no, right? Like from a biomechanics perspective, yes, like people are going to be moving in a certain way. We can identify poor movement, postures, and things like that, and we know that we can relate those to discomforts, which is great. But another thing that a lot of people don't talk about is like fitness levels, strength endurance levels, things like that. And I don't think it's lost on us as a profession and really as a general population. Like America's general population is not very healthy. They're not very fit. They're not very active, right? So it's been my personal goal as a professional, pretty much in every realm that I worked at, to try to help educate people how to be fit for life and not just fit for their job. Functional fitness is great, but like if you're not healthy outside your workforce, like it doesn't really matter. Eventually something bad's going to happen out there, which could impact that ability for you to be able to work, anyways. So as a strength conditioning coach, I kind of bring to the table, educating people on those correlations like, hey, how many push-ups can you do? It's like my favorite question to ask people all the time. And a lot of people don't know because they don't do push-ups, right? And it's like, oh, if you did X amount of push-ups over this period of time at this age, you're actually in this percentile and it decreases your risk for injury by this much. And a lot of people don't know that stuff. But then when you kind of get to talking to them about it, and then the next question is, well, are you going to start a push-up program? And you kind of get to nudge and positively encourage people to be a little bit more involved with being proactive on their health.
I mean, hearing about those little positive encouragements, I think is such a fun thing to bring into a workplace. Just that how many push-ups you can do. It's such an innocuous question
Yeah.
that leads to a really important lesson for people to learn about staying healthy, staying fit, and how those lessons translate from being mindful in the workplace and how it can make your whole life just a little bit better by just getting up, going for that walk, doing a few push-ups here and there.
Yeah, yeah. As a matter of fact, I just got out of we did a orientation here with some of the new hires, and one of the things that I shared with them is something that I just read this morning. Like 4 minutes of vigorous physical activity a day can decrease your risk for cardiovascular disease by 50%. So I'm like, according to research, the number one reason why people don't work out is because they don't have the time, right, across the board. But then this research comes out and it's like, well, do you have 4 minutes a day? Like, if you can do 4 minutes a day, like here's the positive impact it can make on you. And so we all know, or at least we should know, that cardiovascular disease is the leading killer in America. Like it's responsible for the most number of deaths annually. So knowing that there's something that you can do with just 240 seconds a day to help cut that in half. I mean, I feel like that's something people should know. And then the next step is teaching them how they can do that at their house.
I completely agree with everything you said there. Well, Brian, I don't want to take too much more of your time here, so I just want to thank you so much for coming on, sharing a little bit more about your process, about what an ISMP does, and how you can really translate some of those elements from different fields to not only improve the work that you do, but improve people's lives.
I appreciate the opportunity, Matt. Thanks for letting me share.
Of course, thank you so much.